So I just want to thank you guys again for joining us and taking the time to be with us today. So the South Carolina General Assembly is actually meeting today. The House went in session at 10 o'clock this morning for a special June session to debate the budget again. And things are kind of crazy there in Columbia at the State House. So I'm glad I could be with you all instead of there today. This is the first year of the 2-year session with our South Carolina General Assembly. And in this first year, there have been over 1,000 bills introduced between the House and the Senate. Over 1,000 because I truly lost count. There were just too many for me to even try to keep up with all of them. And so these bills have a process of, making their way through one chamber and the other chamber and then to the governor, and there's all these steps involved. And it takes a long time. Sometimes it takes a while to pass legislation in our state. I know that many on this call have worked on the previous tobacco tax campaign, the cigarette tax campaign, and I believe that campaign took about 10 years. And South Carolina still remains one of the lowest states, one of the states that has the lowest tobacco cigarette tax in the country. So we do have some work to do, and I'm asked the question often, well, then what do you do at the State House? What can we do? What can we do to change the tide, to create policy, to really work on changing what the dynamics look like when it comes to tobacco control? And my simple answer, and nothing is really ever simple when we work on tobacco control at state policy, but here's my simple answer. My simple answer to creating strong tobacco control laws and to preventing really bad industry laws like we've worked on this year, it all starts with folks like Irene and Clark and many of you on this call, because it really and truly all starts with strong local advocates, strong local coalitions. That is where our work starts, to make sure that we have policy change that's impactful at the state level. So I want to talk just briefly about this past year and what we worked on for most of the year, and even what I'm monitoring this week and next week as the General Assembly is in the special session, and that is tobacco preemption. And we started off this morning with Gustavo talking about tobacco preemption, and then Mark hit on it again. So tobacco preemption is, very simple layman terms, really bad. It's really bad. It's really bad for local coalitions. It's really bad for the tobacco control work that we want to do in South Carolina. And so a tobacco preemption bill was introduced. It was introduced this year in 2021. It was also introduced in 2019, and we were able to kind of push it back. But it was introduced again this year, and this specific bill would preempt our local communities from working on any tobacco control efforts around flavored tobacco products and around creating a tobacco retail license at the local level. Again, those are two pretty big issues that we've heard from and talked about today. So we know the work that the successful work that other states have done, other communities have done with flavored products and with creating a tobacco retail license. And in South Carolina, that is part of what could be a next step for us. And with that preemption bill, that would prohibit our local communities from really working on good, solid tobacco control efforts at the local level. So the bill was introduced in this year, in January of this year, by the House minority leader and the House majority leader, and it really flew through the House, very similar to what we saw in 2019. I have amazing stories of Dr. Keeley testifying and some of the other folks sharing testimony on this bill, and literally stalking in a very nice way, I may say, stalking one of our House members, trying to reach him and just talk to him for 5 minutes about this bill to get him to change his vote. And the reason that we have been able to hold back preemption this year truly is because of local advocates. It is because of coalition partners. It is because of relationships that we've built over the years with members of the South Carolina General Assembly that we are able to call on them, to educate them, to let them know how bad and how dangerous this is for our state. I believe there were about 9 other states in our general area of the country this year who are also fighting preemption. And to my understanding, South Carolina is the only state that has currently been able to hold off preemption this year. So just big kudos to everyone that helped and all the different coalition partners around the state. I'm sure you all were sick and tired of us saying, please call your legislator, please email them. But it just goes to show the power of grassroots and the power of advocacy when we're all working together. So thankfully, the preemption bill, again, that preemption bill would preempt local communities from working on flavors, restrictions, and a tobacco retail license. That preemption bill has stalled in the Senate, thankfully. We had 4 Senate champions who signed onto the bill to stop the bill. We have a lot of crazy rules in the South Carolina General Assembly, but one of them that often, well, it helps us and it hurts us in different times, in different seasons. But one rule is it only takes one member of the Senate to slow the bill down, to put the bill on what's called a special order, and then it takes a number of votes to get that bill put back on the calendar for debate. So that's a lot of technical terms, but really simply put, we have 4 champions who have stopped that bad tobacco preemption bill that we have been fighting all year. And we are very hopeful that we will not see that come up this week or next week in the budget. And it could, tobacco companies, the industry, their partners are tricky. We all know that. We've worked with them long enough to know that they are tricky. They try all these moves. They don't, sometimes I wonder how they sleep at night. I don't know. But, they're not afraid to try anything. And they have an enormous amount of money. So they can try things. And it is often very scary, the influence that they have on members of the South Carolina General Assembly. And as Dave or someone I think had put in the chat box, we think about the tobacco industry and their allies. And so in South Carolina, that really includes the Retailers Association, the Association of Convenience Stores. There's a huge group of those folks that all work together. And I think at last count in 2019, there were 9 paid Juul lobbyists, specifically for Juul in our state, 9 lobbyists just for Juul. That does not include lobbyists for the VTA, Vaping Technology Association, nor did that include lobbyists for our traditional big tobacco folks like RJ Reynolds and Altria. So I think it was something upward of 20 plus tobacco industry and their allies, lobbyists, that we are really fighting against. And it's sometimes very, very challenging. But again, I want to go back to the impact that it's really truly because of grassroots and because of advocates, local coalitions that were able to push forward. So we worked on this tobacco preemption bill. It's stalled for now. We're hopeful that it will not come up this week in the budget. It could, and we're prepared for that, and we're ready to try to tackle that, but we are hopeful that it won't. The other issue that we really worked on this year that we've talked about today is tobacco retail licensing. And I think that's such an important part of the work that our local communities can do. And Irene, I took a lot of notes here as you were talking because I always like a friendly competition. And so Dave Keeley from the group in Rock Hill has said that they are going to try to work on passing a tobacco retail license by the end of the year. But it sounds like, Irene, your group from Lancaster could also work on passing a tobacco retail license. And then you would be the first in the state to pass that. So I'm just going to put that out there that it's right, it's ready. Before we're preempted, I'm not sure how long we'll be able to hold off the tobacco companies, very honestly, with this tobacco preemption. So before we are preempted, let's get some local communities to work on passing this tobacco retail licensing because we know it works. We know that it's impactful. So I gave myself a time clock here. You guys can't see this, but I have 30 seconds left. So here's my 30-second spill to you on what we know works at the state level and what I think we have to really focus on. So I partner a lot with the American Heart Association, the American Lung Association, with our friends from the Campaign for Tobacco-Free Kids, Mark and the team from the Public Health Law Center. We all kind of work together, and I think we all kind of call ourselves the national partners. And so one of the things that we like to say as national partners of tobacco control efforts is we work on what's called a 3-legged stool. And so the top 3 things that we could do in our state to have the greatest impact, the highest impact. Of course, as I think it was, I'm looking at my notes now, I think it was Mark that said, everything that we do is evidence data driven. So to have the highest impact on tobacco control, what can we do in our state? To pass a comprehensive tobacco tax. Note that word comprehensive, because that is also one of the key elements that Mark mentioned in good policy. So we want to pass a comprehensive tobacco tax that include all tobacco products. We want to make sure that in that tobacco tax that they have clear definitions, another key element of good policy. So we want to pass that comprehensive tobacco tax. We want to increase the funding that is spent on tobacco control efforts. So I think that the CDC recommends something like $51 million that South Carolina should be spending to work on tobacco control efforts in our state. Right now, the state gives around $5 million, and there's some other fundings that's here and there, but it's around $5 million to work on tobacco control efforts. So there's a huge disparity there. Do I think we're going to get to 51 million in the next year or two? Absolutely not. But I think we can see increases every year, and that's what we should be working toward. And then the third part of that stool, so we talked about tobacco tax, we talked about increase in control funding, and the third part of that is, again, I just keep pointing to the work that Irene and so many others have done, is continuing to work on tobacco-free, smoke-free policies around our state. We are still under that 50% mark of our state being covered with tobacco-free ordinances, laws, and we want to get to 50 plus 1%. So we still have a ways to go before then we can work on a statewide tobacco-free law. But those three things, we know we have evidence to prove that if we work closely, solidly on those three efforts, part of what we call the three-legged stool, that we can really see our numbers be impacted in the state. So lots of work that we can be doing, but thank you guys so much for all that you have done this year to help fight preemption and kick tobacco's butt just a little bit. It's been good.
As y'all can tell, Beth is very passionate about the work that she does. Thank you very much, Beth. That was a great coverage for us. So what I want to do now is I want to invite y'all to put any questions you have in the box, but specifically related to advocacy and how we accomplish things at the local level and moving up to the state level. If any, I mean, maybe everybody's heard everything they want to say, or if you want to ask a specific question about the advocacy work of any of these folks on here, please throw that in the chat box. I know we're probably all getting a little bit hungry. It's getting to be that midday time. And so I'm just going to give that a moment. I think we seem to be good with that. You know, Beth, Clark, or Irene, I think I'm going to, because you have one question that I was going to pose, and I got so many pieces of paper on my desk. I think this is what I wanted to ask each of you, just as a closing question, is what is one single piece of advice that you would give to whether it's a local group or whether it's a school or any kind of grassroots kind of advocacy? What is one piece of advice you would give to help organize effectively and to make an impact? What is one piece of good advocacy advice you would give? I think I'm just going to go in order of y'all speaking. So Clark, if there's anybody out here that has you know, influence or in schools in terms of school policy or is involved in school policy, what is one piece of advice you would want to give to helping create effective policy for schools and you know, relating to tobacco violations?
Sure. I would say use common sense. We used to have an approach, I think, that if we couldn't do it for all kids, we wouldn't do it for any, you know, because we want to be fair. Now I think we look at things a little bit more. If we can do it for this person, you know, then we try to do it. Or if we can do it for this group, or if we can do it for, you know, this this cohort of people that are perhaps dealing with an issue or what have you. Try to, versus the approach of if you can't do it for everybody, you won't do it. So use common sense and find solutions and wins.
Thanks, Clark. Irene, how about you?
For us, really is, you know, finding and leveraging those essential community partners and champions that have those similar goals. Again, we have one council member. He was able to kind of pave the way for the rest of council. My vice chair, he was actually a professor at the university, so he was able to talk to the superintendent or, you know, the dean there, you know, letting the superintendent of the school know that, you know, that August 1st policy was, passed, and that we have to, comply by that. So finding those resources, those community champions that are willing to help you out and support you. DHEC was instrumental, like really utilizing DHEC. They'll be able to help you with all the verbiage and really have that comprehensive policy in place to make sure there's no loopholes or anything like that. And then I'd also say probably finding the strategy that works best for you and your community. So for us, instead of focusing on that emotional piece of, smoking is my right, and, things like that people were so honed in on, again, we kind of shifted that focus to, well, we're going to focus on workplaces and businesses and, secondhand smoke, and really focus the data on secondhand smoke. And, so you guys could see that it doesn't just affect the smoker, but also the non-smoker. So finding that strategy that really works well for your community will really help you move forward as well.
Great, thanks. Beth, what's your closing advice?
Read the question again, Rebecca. I was answering Dr. Mike Cummings in the chat box. So,
well, it was just broad. It is, so we're going to be going forward, and for anyone that wants to get involved in something at the grassroots or the local level related to advocacy, what is one piece of good starting advice? Where do you start? What would be important to keep in mind?
Yeah. So I think a lot of folks are often afraid to get involved in advocacy. They're afraid to get involved in politics. And so I would just encourage you to remember that your elected officials at all levels, so from city, county council, all the way up to the state level, all the way up to the federal level, are normal people just like us. And I say that and want you to be encouraged that, you can talk to them. They may not always be accessible, but there are different ways that you can talk to them. You can find people that may know them. So don't let that stop you. Don't be afraid to get involved in politics. Don't be afraid to get involved in advocacy and education, because everyone can do that. And quite frankly, whether you realize it or not, just by being on this call today, you're an advocate already. So don't be afraid. Think about how you can get involved and just go for it.
Okay. Irene, there's a question for you for Dr. Keeley in the chat box. How much does your group use social media for community grassroots education? Which channels were most effective in Lancaster?
So yes, we have a Facebook, Instagram, and Twitter account that we utilize, and we share information from like you guys, Smokefree SC, or our vaping brochures or little PSAs on vaping or smoking, and so we have utilized that. I will say, in Lancaster particularly, we have a large older population, and so and we're rural, so broadband issues and things like that, and a lot of people don't have access to that. So we also utilize things like the newspaper, because people still very much read the newspaper over there, and so we like to put articles out and letters to the editor and things like that as well. And also we utilize like health events, obviously not in 2020, but before then we used health events, and we would pass out information there. That way people had a physical copy in their hand that they could read as well. So we try to utilize different channels just because of that access piece as well, and that literacy piece. So making it, easy to read, easy to understand for a different variety level of people's. That's definitely important too. There was a study saying that a lot of people in rural areas do utilize Facebook a lot more than the other social media channels. So we do tend to use Facebook a little bit more than Instagram and Twitter, but whatever we post there, we tend to post on both, all three of them. So.
Okay. Yeah, Beth just entered in the chat box how you find your state legislators, if you would like that link. I don't have any other questions for you all. This was so informative. I've seen a couple comments in the chat box thanking y'all and letting you know how much we learned. I think, there's two things here. I mean, this whole summit was focused on youth and on youth vaping, but the conclusion of where we are today is really about the broader base of advocacy related to protection against tobacco controls. So